The Autism Research Institute relies on the generosity of donors like you to make this webcast possible. If you enjoy this presentation, please consider making a donation. Thank you.
Now, before we get started, I'd like to introduce our speaker. Dana Lakey is a licensed nutritionist specializing for 40 years in complex medical nutrition issues affecting children and adults. An honors graduate from Temple University, she received her Master of Science in Nutrition from the University of Maryland. She has also served as a health issues legislative assistant and received 4 gubernatorial appointments to 2 healthcare regulatory boards. Dana is an educator, hosts a healthy living radio show, and is co-author of the kid-friendly ADHD and Autism cookbook, The Ultimate Guide to the Gluten Casein-Free Diet, and her newer book, The ADHD and Autism Nutritional Supplement Handbook. You can type questions for Dana into the questions section starting now and throughout the talk. We will answer these at the end. These webinars are made possible through generous donor support. If you'd like to contribute, please visit our website at autism.com. And now I'm going to turn it over to our speaker.
Well, it's good to be here, and I hope you find this interesting, and I look forward to the questions at the end. This is just an overview of what we're going to cover today: healthy pregnancy, healthy child, start early. We'll talk a little bit about epigenetics, infertility risk factors, autism risk factors, evaluation, nutrition factors, and dietary factors. Now, environmental modification of gene expression is important to understand. It's when genetics and environment meet. And what happens is something called epigenetics, or gene expression. And the reason this is important is that when we're looking at autism or any condition, any health condition we get, the impact of whether that gene expresses itself or not depends on us and what we do and what we're exposed to. So prior to this discovery, which was in the mid-90s, it was thought that genes were not subject to change, with the exception of very rare mutations. Now we have a much greater understanding. The genes can be turned on or off to express themselves. So the expression or lack of expression can be beneficial, or it can be damaging. The environment, lifestyle, diet, toxic exposures, stressors, infections has a profound effect on how the genes express themselves. The genetic sequence is the hard drive. Epigenetics is the software that determines how and when the sequence will be read, and that is a statement from Dr. Jill James. The effects of gene expression are passed on to multiple generations. That is what is so important to remember here. Gene variants are different forms of a gene that vary according to their sequencing. They are heritable, and they may or may not be damaging depending upon the variant and the influence on the variant. There are some heritable disorders that now appear to be epigenetic rather than genetic. Schizoaffective disorders, OCD, ODD, bipolar, autism, cancer, and many others. So we look for a healthy pregnancy and a healthy child. And we will cover preconception care, prenatal care, genetics, individual biochemistry, toxics and medication exposures, lifestyle, diet, and nutrition. So that's just an overview. Now, planning and prevention, fertility, pregnancy, and fetal health. Multiple risk factors interact to cause problems in fertility, pregnancy, birthing, and child development. Single risk factors alone are less potent. The more risk factors, the more potential for complications. Testing of potential parents focuses on identifying the applicable risk factors, and treatment is then based upon genetics and family history, biochemical individuality, laboratory and clinical findings, and definitely seek the guidance of a medical nutritional specialist. Now, let's go forward. Infertility risk factors. Now, these are for both parents. Age, maternal over 30 and or paternal over 35. And we're talking about infertility now. Genetic conditions, use of alcohol, tobacco, drugs, and toxic exposures, medications which can interfere with fertility, nutrient deficiencies, a history of infertility, infections, and inflammation. Paternal would be testicular and or prostate problems, maternal endometriosis or uterine fibroids. These are just examples. Now, let's look at paternal infertility risk factors: undescended testicles, injury to the testicles, vas deferens blockage, spermatocoid varicosities, varicoceles, retrograde ejaculations, previous vasectomy, cystic fibrosis. Also, spinal cord injuries, prostatitis, hemochromatosis, sickle cell anemia, systemic disease, testicular cancer, STDs, and making antibodies to sperm. Sometimes this is the case, and that creates a problem. So both parents' infertility risk factors, we'll go forward. Now, let's look at more paternal infertility risk factors. Age 35 or older. Alcohol, amphetamines, cocaine, heroin, marijuana, PCP, steroids, tobacco, phytoestrogens, especially soy, excessive heat, excessive caffeine, celiac disease, toxic metal exposures, harmful chemicals, endocrine disruptors, and medications for cancer, cardiovascular disease, arthritis, or gout. Now, the nutrients in paternal fertility. The following nutrients improve sperm motility, concentrations and morphology, and increase impregnation and live births 4 to 5-fold higher. Very important. Vitamin D and E, vitamin C, CoQ10, zinc, quercetin, selenium, carotenoids, folate, and we'll talk about L5-methyl tetrahydrofolate and folinic acid instead of folic acid, glutathione, and L-carnitine. Very important. So on this slide, improving male fertility, I've described what a multiple vitamin mineral should contain, and a multiple vitamin mineral is only going to be effective if it really has all of this, and if it has all of this, it's going to take 4 to 6 capsules. If you're not getting enough D or E, you can add separate. Probiotics are extremely important. Omega-3, at least 1,200 milligrams or more. L-carnitine, 250 to 500 milligrams. L-arginine, 250 to 500 milligrams. CoQ10, 50 to 200 milligrams. Pumpkin seeds, ground flax seeds, and herbs such as ginseng, the Panax ginseng, and astragalus, and additional as needed, vitamin D and glutathione. Now, maternal infertility risk factors. Previous problems with a pregnancy. Eating disorders increase miscarriage and prematurity. Less than 18% body fat increases the risk for infertility and poor fetal outcome. So the ideal BMI is 20 to 25. Maternal obesity increases the risk for infertility, miscarriage, preeclampsia, and infections including periodontal disease increases inflammatory prostaglandins and can lead to premature birth and low birth weight. I'm a dental hygienist as a background career that I had before my interest in nutrition, and I can't tell you how important it is to have excellent periodontal health. Familial, conception, genetic, these are autism risk factors. Autism spectrum disorder risk factors. Familial, parental age over 35, a history in the family of ASD, OCD, genetic conditions, Fragile X, Tourette's, Down syndrome, seizure disorder, psychiatric conditions, gene variants, developmental delays, immune dysfunction. Now for conception, the ICSI technique that's in vitro, it's the in vitro fertilization. This is associated with increased risk for many kinds of developmental issues, including autism. It's called intracytoplasmic sperm injection. And what it does is it forces the egg to accept a sperm that's too weak to get through, or the egg has rejected it. So that ICSI technique is questionable. Maternal issues, being very susceptible to toxins and toxins that cause birth defects. Also having the gene variant known as methyl tetrahydrofolate reductase and a CBS variant. Child in utero, what risk factors? The presence of multiples, genetic disorders that developing fetus, developing child has, DNA deletions or duplications, COMT and MTHFR variants, congenital disorders, viral encephalitis. Now, more risk factors. Recent oral contraceptive use, history of infertility, 2 or more spontaneous abortions, carrying multiples, high prenatal stress at 21 to 32 weeks, defects in methylation, MTHFR and/or sulfation, increase in ASD copy number variants, CNVs they're called, and these are really very exciting new findings that can help us identify people who will be at risk. Use of an SSRI antidepressant during pregnancy, nutrient deficiencies, vitamin D, B vitamins, iron, iodine, and others, less likely to take prenatal nutritional supplements, and there are references on this slide, and you will have the handout so you'll have the advantage of looking at those. Now, ASD maternal nutrient status, what do we tend to see as dysfunctional? Methylation, sulfation. Sulfation has a lot to do with getting toxins out. Methylation has to do with brain development and many, many other functions in the body. Oxidation, mitochondrial, that's the furnace of the cell, and very important to provide the electricity, ATP, the body needs. Autoimmunity, inflammation, toxic metals, digestion, absorption problems, and deficiencies of nutrients such as omega-3, vitamin C and E, vitamin D, folate, B12, B6, zinc, magnesium, iron, and iodine. Now, the womb environment risk factors. Alcohol use is #1, and I'm going to emphasize that in the next slide. Again, carrying multiples. Some of these are repetitive, but it's important to take this in. Medications, especially those that are pregnancy category D and X. Inflammation, toxic metals such as mercury, lead, arsenic, cadmium, copper, and now fluoride. Fluoride is being looked at as a big concern in causing all kinds of risks for development. Hypothyroidism can cause lower IQ. Infections, many different kinds, viruses, spirochete infections, these have an impact. Diabetes. Now, defects and deficiencies in MTHFR, sulfation, increased cytokines. Those are pro-inflammatory, and these can be measured. When the mother makes antibodies against the fetal brain protein, that's a fairly significant risk factor. Nutrient excess, vitamin A. Nutrient deficiencies, B vitamins, folate, B12, B6, vitamins D, 3, and E, and again, iron, iodine, omega-3, magnesium, zinc, and choline. Now, why is alcohol the most potent teratogen? The fetus can't clear alcohol well. It interferes with development in all 3 trimesters from conception to right before birth. It increases the risk for spina bifida because of its antagonism to folate. It increases the risk for prematurity and depletes magnesium. It causes fetal alcohol spectrum disorders, which have specific facial characteristics, mental retardation, developmental delays, defects in heart, lung, kidney, motor, and sensory, attention, behavior, reasoning, and memory problems. There is no safe level of alcohol intake in pregnancy. Now, let's look at the environment in general that affect the father, the mother, the developing child. 84,000 manufactured chemicals in the U.S., only 200 have been tested according to the EPA, and according to the 1976 Toxic Substances Control Act, testing by manufacturers is entirely voluntary. 17,000 are kept secret by law from public agencies and governments. 287 toxics in newborn umbilical cord blood. They have carcinogens, neurotoxins, developmental toxins. Organophosphate pesticides can cause neurotoxicity. This is a very big deal and certainly being studied in much more detail. Lots of references there. The womb environment, food, artificial additives, and preservatives. Now, the American Academy of Pediatrics does acknowledge, through a meta-analysis of 15 trials, they concluded that a wide variety of chemicals can result in neurobehavioral toxicity, and some children may actually be more sensitive. And that's the key. Who is sensitive? Environmental modification of gene expression. It's what you come into the world with and what happens to that. So some people are far more vulnerable. A preservative-free, food coloring-free diet is a reasonable intervention according to the AAP. This is a dramatic change. In the past, they believed that foods and additives had nothing to do with child development, IQ, learning disabilities, etc. And the editors actually noted, we as skeptics who long doubted parental claims admit we might have been wrong. I love this. Now, the womb environment medications, and these are just examples that antacids block absorption of multiple nutrients that are necessary in pregnancy and fetal child development. Diuretics, hydrochlorothiazide, very important, depletes sodium, zinc, B vitamins, potassium, magnesium, and can increase glucose, uric acid. These are all problematic. Beta blockers for high blood pressure. They also have some significant side effects. And the statins, I have to emphasize this. The statins are category X. They cause birth defects because they turn down the production of cholesterol, and cholesterol is important for a developing fetus, a developing child. It's important for brain and neurological development. And the SSRI antidepressant use increased risk for autism. Now, genes and environment equals epigenetics. We talked about this. So in a study looking at genetic heritability and shared environment factors among twin pairs with autism, the susceptibility to ASD has a 38% genetic heritability and a 62% environmental component. So it's not that if one twin gets it, the other is bound to get it. And this is a great example. Identical twins, they have the same genetics, same DNA, but here we go into environmental modification. John has severe autism. His first 6 months, he had congenital heart defects, surgery, anesthesia, and strong medications. Then we look at Sam. He has Asperger's. He's high functioning. The first 6 months, he was healthy. Both boys were predisposed to autism. One developed it severely. The other developed it as high functioning. Now, prenatal vitamins and gene variants, and this is looking at ASD risk. The most significant timing for taking prenatal vitamins was 3 months before conception or the first month of pregnancy. And this was a very soft study. More thorough studies are going on right now. This was very soft. Mothers of typically developing children were more likely to report taking prenatals. Mothers of ASD children less likely to report taking prenatals. And the ASD risk increases if the mother or child have gene variants. And it's worse if both the mother and child have gene variants. So ASD perinatal risk factors. Now the infant status risk factors: male, low birth weight, hyperbilirubinemia. And if that's not treated, we know it leads to mental retardation. But it is telling us something about the ability of the body to utilize vitamin E, or the ineffectiveness of the vitamin E that has been taken, meaning someone needs more vitamin E. It also speaks to this issue of detoxification. So it's an important finding. A low 5-minute APGAR, meconium aspiration, small for gestation age, ABO-RH incompatibility, mitochondrial disorders, congenital malformation. Now, genetic disorders account for 5 to 20, about 20%. PKU, Fragile X, Rett syndrome, neurofibromatosis, tuberous sclerosis, Angelman syndrome. So many people may have these genetic issues if they haven't had a genetic workup. And right now, I've been involved in a child who had PKU. It showed up mild at birth and was not addressed. And that's fairly simple to correct when we look at all kinds of genetic disorders. And I've seen that happen several times. We encourage parents to get the records, and PKU may not show up initially. It may not show up for months, so a repeat of that is important. Okay, ASD perinatal risk factors, birth conditions and complications. So an abnormal birth presentation, breech, multiple birth, twins, triplets or more, fetal distress, birth injury, a lack of oxygen, hypoxia, umbilical cord complications, obstetric complications, maternal hemorrhage, less than 35 weeks gestation, and a summer birth. Now, evaluation and testing, very important, 6 months to a year in advance. What do we look at? First of all, medical history, family, ancestral, ethnic, genetic, and this should be done by an OBGYN. Certainly a primary care physician can participate in some of this. But these are important. A review of risk factors, lifestyle and exposures. A review also of prescribed and over-the-counter medications, nutritional supplements, alcohol, tobacco, and drugs, complete physical examination, menstrual history and status, reproductive history, a complete gynecological examination, and a complete pre-pregnancy lab work. You should write these down. If you're planning pregnancy, put this on a list and hand it to the doctor. Don't wait for someone to ask the questions. Now, testing may include, and should definitely include, the basics, the CBC with differential, a chem screen, full lipid panel, iron profile, complete iron profile, very important. Thyroid testing, very important. Vitamin D3, very important. A blood ABO-RH for both parents. Hep B, syphilis, HIV, both parents. If diabetes risk, we want to see a hemoglobin A1C, glucose tolerance test as well. Vaccine titer levels, a pap smear, group B strep to see if the mother has that, and STDs, and a genetic workup if indicated for both parents. So these are things that you can identify and address so that each parent is in the healthiest point. They're in the healthiest of their genetic range before getting pregnant. Preconception and prenatal testing can also include homocysteine, fasting total plasma homocysteine, and this is very critical. If homocysteine is high, you can have more birth defects, risk for autism in adults. There are other risks. And if this is high, it's very important to consider MTHFR testing. Vitamin D3, I mention it again, it is so important, and it must be done on any woman planning on getting pregnant or being pregnant. Organic acid urine test for nutrient functions, methylation, sulfation, neurotransmitters. What we learn from this is how the nutrients function in the cells. This is critical information. A red blood cell mineral panel, because serum levels do not decline until late stages, and a hair analysis for minerals and toxic metals. Preconception and prenatal testing, we can also look at celiac blood testing, opiate peptide urine testing for gluten and casein, adrenal profile, digestive stool, porphyrin. These are sophisticated testing, and you're going to find that individuals who work in nutrition, this can be physicians, nurses, nurse practitioners, nutritionists, dietitians, they understand more about these tests, and some people will benefit from them based on history and findings. Dental evaluation, remove mercury amalgams, but not within 6 months of conception, because the removal or placement of mercury amalgams exposes the entire body to mercury. And mercury is more toxic than lead. And the fact that it's in the human mouth is just hard to believe. Do not do this while pregnant unless there is no way of avoiding it. Consult with a biological dentist for safe mercury amalgam removal and or safe mercury-free, bisphenol A-free restorations. Maintain periodontal health. Routine dental prophylaxis, home care. Make sure you do your home care. Periodontal disease increases the risk of early delivery and low birth weight. Now, 6 months to 1 year in advance, nutrients and supplements. What do? First of all, understand the nutrition terminology. The RDA recommendations are sufficient to meet the nutritional requirements of 97 to 98% of healthy individuals. That's healthy individuals. They do not apply to more than 70% of the population who have chronic conditions and to those with developmental delays, gene variants, and biochemical individuality. Elemental, that's a nutrient amount that's available for absorption. Calcium carbonate's a compound that's 40% elemental calcium. Now, what you have to understand is no mineral can be substituted as just magnesium or calcium or zinc. They all come as a compound, and hence the macro minerals take up a lot more room in a supplement. Now, nutrient absorption is that amount that actually crosses the GI tract. If you're taking in a lousy diet and not supplementing for your age, stage, and gender, then there's no way your cells are going to get what they need. And then nutrient absorption is crossing the GI tract. Then from there, by the way, this depends upon nutrient form, antagonists, agonists, digestion status, and level of deficiency, because you absorb more when you're deficiency. Nutrient bioavailability is what is available for function. And nutrient function is the bottom line. What we care about is, does your system utilize nutrients and give you function? Or do you have blocks to that? Do you take diuretics, have antacids? Now, nutrient forms and sources, they vary. Natural forms are naturally occurring nutrients, which are food-based and can be extracted from food sources, usually require taking more substance and can cause reactions depending upon the food sources. Synthetic forms are made in the lab, manufactured in the lab, and they can contain active sites identical to the natural or artificial forms. They're used when therapeutic high doses are required and usually require less substance and are less expensive. Artificial refers to non-natural nutrient forms, which are not the best forms used by the body and may be much less effective and in some cases quite harmful. Now, physiologic activity will vary among the different forms. So this is important to understand. Synthetic's not bad. If it's manufactured and it's the identical structure of the useful natural form, that is fine. But synthetic forms can also be the artificial forms, which are not beneficial. Probiotics in pregnancy. This is a very big deal. 10 trillion human cells to 100 trillion bacteria. So we are 1 part human and 10 part bug. And that's important. And we need to bless them. It's good that we have them. Gut flora support systemic and digestive immunity. 70% of human immunity is actually located in your digestive tract, and it's fed by these good flora. This is what's important. So probiotics in pregnancy, 10 to 50 billion, and that's not a lot. In a yogurt that you have fermented, it's well fermented, you're going to find that you get a lot more activity than 10 to 50 billion. They improve nutrient absorption, digestion, they reduce inflammation and intestinal and vaginal infections. They reduce gestational diabetes, prevent asthma, allergies, and eczema in the child for up to 2 years. In infants, probiotics, 5 to 10 billion, reduce sepsis, allergies, asthma, and eczema, reduce or resolve colic, diarrhea, diaper rash, and thrush. And fermented foods, coconut, kefir, sauerkraut, kombucha, they provide 100 to 700 billion probiotic count per serving, depending on how long they're fermented. So probiotics, I like to joke that the national debt should be our goal for probiotics. Now, biotin, maternal deficiency will show up as dermatitis, eczema, seborrheas, yeast overgrowth, depression, dull, flyaway, colorless. The hair color is kind of dull, and paresthesias, the numbness, tingling. In the fetal infant deficiency, we see fatty acid defects, developmental delays, dermatitis, eczema, seborrhea, thrush, yeast infections, seizures, acidosis, and again this dull, dry, flyaway hair. Now, it's produced in the GI tract by our own gut bacteria that we need, but they are depleted by antibiotics. So many people do not manufacture enough biotin. Anywhere from 500 micrograms to 20 milligrams. We recommend generally 5 to 10 milligrams. It's non-toxic at any level. So these are the signs that you might see in a biotin deficiency. And this is not recognized. The treatment is always topical steroids and other kinds of creams, but we need to get to the core. Now, general symptoms, skin, eczema, dermatitis, poor cognition and vision. This is omega-3, EPA, and DHA deficiencies. So there's a lot of overlap in the nutrients and the effect on skin. And what I've done is group these together in those nutrients which have the most common effect together. So mood disorders, immune dysfunction, frequent urine and thirst, maternal infertility, preeclampsia, postpartum depression. In the fetus infant, fetal growth delays, developmental delays, cognitive impairment, vision dysfunction, poor eye contact, eczema, allergies, attention disorders, DHA importance, brain and retinal structure. This is so critical in conception, in pregnancy, in the child's health. It has a long-term effect, and there is no age at which we don't need to be taking in omega-3 fatty acids. And I put here on this slide, which you can refer to in your handout, the type of EPA, DHA, fish or krill oils, molecular distillation, and making safer seafood choices. Here we are. Avoid limit. I put in red the ones to avoid and limit. The largemouth bass, croaker, halibut, king mackerel, marlin, oysters, pike, shark, swordfish, tilefish, tuna, albacore. The big old fish are higher up the food chain and they have concentration of toxins. Sardines are probably the healthiest of all foods because they are young and they are small. Fish consumption in pregnancy. It's interesting that women who consumed more than 340 grams of seafood per week had more intelligent children who had fewer behavior problems. The next one, the mothers who ate no fish were 50% more likely to have a child with low verbal IQ score. And this discussion of whether it's okay for women to eat fish when they're pregnant, we do recommend it. We recommend the safe ones. If someone is not eating seafood and not getting good sources of EPA, DHA, the dose range should be best based on lab tests and status, and that is DHA at 500 to 1,000 milligrams and EPA 500 to 2,000 milligrams. Very important. Now, zinc and magnesium actually affect more than 300 to 400 enzymes in the body. This grows every day. They affect gene expression, cell membrane structure, function, stability, epithelial integrity, skin, mucosal membranes, retinal binding protein. It's the carrier for vitamin A, so the prime cause of vitamin A deficiency is zinc deficiency. Growth and development, brain pruning and toxic metal metabolism, sensory development and function, and spermatogenesis, healthy sperm. So what do we see? And this is what we often see in autism: vision, auditory, smell, taste, touch, processing issues. Now, zinc deficiency, the clinical clues: poor epithelial integrity, meaning susceptible tissues. So there's eczema, dermatitis, pregnancy, acne, infant acne, and white lines on the nails. That's easy to look at, and we do find that to be quite true. And zinc is synergistic with vitamin A, vitamin D, omega-3, and they all affect skin, as does biotin. So they're a group that's very helpful. In the adult, zinc deficiency will show up as vitamin A deficiency. Infertility, this applies to both parents. Gestational diabetes, impaired folate function, poor gene expression, toxic metal excess, inflammation, immune disorders, gene expression dysfunction. And we talked about gene expression and epigenetics, and that we pass it on for multiple generations when we do it right and when we do it wrong. Fetal death, teratogenesis. This is the risk of zinc deficiency in the developing infant. Prematurity, low birth weight, fetal growth delays, infant acne and eczema, immune dysfunction, impaired brain pruning, sensory dysfunction, low tone, and gene expression dysfunction. Now, the amount in pregnancy is 20 to 40 milligrams, and this depends on testing. I'm giving you ranges to go by. Now, this severe form of zinc deficiency doesn't show up until after weaning from breast milk, because breast milk zinc is well absorbed. Formula zinc is not. They give the same amount, but the formula lacks the agent in breast milk that helps zinc absorb well. And it leads to immune disorders, developmental delays. Biotin deficiency contributes to this presentation as well. Vitamin A and beta-carotene. Vitamin A excess can be toxic, and it depletes the other fat solubles, and it can increase bone loss. Beta-carotene excess depletes vitamin E. It turns skin fatty tissues yellow. It is not toxic. It's just unattractive when you're really yellow and somebody asks you questions about it. It builds up in fatty tissues, and if vitamin A is adequate, Carotene doesn't convert to the vitamin A that can be toxic, so there's a safety net there. But diabetics do not convert well. Vitamin A deficiency, some clinical clues: the acne, eczema, dermatitis, ridged nails, keratosis pilaris, chicken skin, and that shows up on the cheek there on the left and on the arm, and these can get infected, but these are core nutrient deficiencies, primarily vitamin A, but also zinc. And A deficiency in pregnancy can cause cleft palate, vision impairment, blindness, keratomalacia. And excess can cause small head size, small jaw, small eyes, mental retardation, facial dysmorphia, missing earlobes, vision impairment, hearing impairment. So too much and too little can be a problem. Vitamin D in pregnancy and fetal health, maternal bone health, maternal immunity, and pregnancy health. Deficiency can show up with vitamin D, deficiency preeclampsia, gestational diabetes, increased risk for C-section, vulvovaginal infections, depression, seasonal affective disorder, and what happens? That's in the winter, and what we don't get much of in the winter is vitamin D, and postpartum depression. Now, let's look at fetal health. Skeletal developmental problems, brain developmental problems, immune developmental problems can occur. Newborn infections, newborn seizures, mental retardation, infant asthma, developmental delays, and increased risk for ASD. So, vitamin D deficiency, a visual, late closing fontanelles, deformed skull, bossing, a very high and forward forehead, enlarged knees, wrists, and ribs, eczema, dermatitis, chronic chapped lips, bowing of the legs, low tone, developmental delays, learning disabilities, delayed tooth eruption, profuse sweating. Now, vitamin D in pregnancy, this is really critical and important information. Vitamin D is equal to folate in importance to fetal development and outcome. This is why you want to take a list to your doctor and discuss the vitamin D and why you want to be tested. Some OBGYNs will do it automatically. So you've got information here that you can take and discuss with your gynecologist, OBGYN, and your primary care physician. Now, calcium deficiencies can show up in the mother as preeclampsia, seizures, muscle cramps, palpitations, high blood pressure, tremors, bone loss, brittle nails, insomnia, and anxiety. And in the fetus infant, shortened gestation and low birth weight. Now, this is important. You cannot take calcium without half as much magnesium, or that calcium will increase inflammation. High-dose calcium without magnesium increases inflammation, cardiovascular disease, soft tissue calcifications, and even affects mood and memory. And right now, the recommendations are taking 750 to 1,500 milligrams of calcium. And a huge study on women showed that bone improvement did not occur. And if you don't have adequate D and adequate magnesium, the calcium isn't utilized well, and then it becomes damaging. And high calcium without magnesium suppresses your own stores of magnesium. So this is a critical piece. Magnesium, it's responsible for 3/4 of all enzymes in the body. In pregnancy, deficiency will show up as pregnancy nausea, preterm labor, hypertension, preeclampsia, miscarriage, premature birth, deficiencies of calcium and potassium, and also postpartum depression. This is a major nutrient in preventing postpartum depression. In the infant, it can cause apnea, SIDS, irritability, prolonged startle, poor sleep quality, infant seizures, febrile seizures, and night terrors. Somewhere between 400 to 800 milligrams is very important in pregnancy. It's hard to get too much magnesium. The reason being is if you take more than you need, you'll get diarrhea and you'll lose magnesium. So it's called magnesium-induced magnesium deficiency. So it's called bowel tolerance take up to the point that your stools should be formed. They should not be loose, and you should not have diarrhea. Selenium. Some of the functions are glutathione peroxidase, very important in detoxing us. Sulfation, antioxidant, thyroid function, and it's synergistic with vitamin E. You can't treat nutrients like we do medications. If you give only one nutrient, you create an imbalance in the other. And pregnancy, this is important in fertility for males and females, recurrent miscarriage, thyroid dysfunctions. In the fetus infant, growth delays, a low red blood cell glutathione peroxidase, which can be measured, immune dysfunctions, and supplements are between 50 and 200 micrograms. Vitamin E, very important in fertility, especially for the male. Low levels can cause miscarriage. And in the child, there'll be fetal growth delays, high bilirubinemia. Bilirubinemia is diagnostic of vitamin E deficiency. And it's often more prevalent when pollution is high or the mother smokes because vitamin E is depleted. And deficiencies can promote developmental delays, apraxia, low tone, loss of reflex, anemia. And I've listed here the ranges, 100 to 200 IUs, and that should be mixed alpha, mixed D alpha, and gamma tocopherols. Folate defects and deficiency. Pregnancy causes anemias, macrocytokines, fatigue, depression. Your homocysteine goes up. Memory problems, glossitis, gingivitis, neuropathy, cervical dysplasia, melasma, and I'll show you some pictures. We recommend that women who are trying to get pregnant or are pregnant not take folic acid. There are many supplements now that include the active forms, L5-methyl tetrahydrofolate or folinic acid. These are directly active. Folic acid does not convert to the active form in those who have something called the MTHFR defect. And it's better to cover your bases by taking the proper form. If you don't and you have the problem, folic acid can actually be harmful. So what do we see in the fetus or the child? Failure to thrive, developmental delays, neural tube defects, macrocytic anemia, and risk for ASD. And the ASD child supplement and the dose I put on the prenatal supplement. And we use tests like FIGLU, which is a measure of folate status and MTHFR gene testing. So this is exciting times because we have more tests. So folate and B6 show up as pregnancy deficiencies, show up as pregnancy hyperpigmentation, melasma, and the linea nigra, the dark line on the tummy. And folate deficiencies themselves show up as pregnancy, gingivitis, and neural tube defects. So in pregnancy, B vitamin deficiencies, this glossitis is a loss of papilla, and it doesn't have the healthy salmon color. You don't see what most people identify as taste buds, little filaments. And along with this is fatigue, depression, neurological symptoms, and lots of maldigestion, malabsorption. This is much more prevalent in people who take antacids long term. And here's the prenatal dose. It may need to be higher based on testing. A geographic tongue has splotches that wander. They look different every day. Again, B vitamins, it can be hormonal. This is very common in pregnancy, usually common in autoimmunity, and that's something that we ask the moms to be about. And so we want at least 50 milligrams, 25 to 50 milligrams, and methylation support, that's B12, folic acid, B6, and other cofactors. Vitamin C is extremely important. It has very broad effect. Again, it's hard to take too much. If you take too much, you get diarrhea, and you don't want to do that with any supplement. It means that you're taking more than your body needs at that time. Bruising can occur with vitamin C deficiency, iron deficiency, inflammation, low white blood cells. Now, what are the principles for supplementing? Introduce the best tolerated supplement first. Start low and go slow. Introduce one new supplement at a time. Start with a lower dose. Increase is tolerated, but stop if there are problems. Add another supplement in 1 to 5 days, and continue the supplement if well tolerated. Do not stop a supplement because you don't see the difference. That's like going to the bank and asking for your interest that you've earned and you just made your first deposit the day before. It takes time. And so if there is no problem taking the nutrient, you should stay with it. Problems with the prescription prenatals. This is just a few, but they're important. One pill does not fit all. It cannot possibly include the nutrients that are needed. It simply does not. Folic acid at 800 to 1,000 micrograms, but the other B vitamins are low or absent, and these are like the fingers on your hand, the B vitamins. They work together. They're synergistic. So when we only give folate, it doesn't get utilized if it doesn't have B12, B6, some of its friends, its co-workers. And the L5-methyl tetrahydrofolate or folinic acid is preferred. I'm repeating myself because it's so important. Folic acid is damaging in methylation disorders, and if you don't know whether you have one or not, and 60% of people can have some gene variants of methyl tetrahydrofolate. So you're better off covering yourself with the active form. There's no harm in doing that, whereas you can fail to get good function or even do harm with folic acid itself. Folic acid itself is artificial. Vitamin E at 10 IUs, which is in most prenatals, is too low to protect against hyperbilirubinemia. And it's most contain DL-alpha, which is 50% less effective or not effective at all. The ideal is mixed natural tocopherols, especially gamma. Iron sulfate causes constipation. It's antagonistic to vitamin E. So here you have a lot of iron and a little bit of E, and you're going to create an E deficiency with the high-dose iron in the sulfate version. We prefer the chelates, fumarates, bisglycinates. Calcium is 100 to 200 milligrams. It's really not enough. 800 milligrams or more is recommended, but it really depends on the diet. If a woman's diet is good and she's not using sodas and caffeine to deplete calcium, then she doesn't need as much supplement. Magnesium is required for calcium utilization. It's usually low, pathetically low in the RX prenatals, or absent. There might be 25 to 50 milligrams. And low magnesium increases the risk for toxemia, early labor, and SIDS. Just a reminder. Chromium's absent. Chromium reduces the risk for gestational diabetes. And when you're pregnant, you deplete chromium. So this is very important. Now, what I've done on this slide is list the important nutrients in a prenatal multiple. And what you want to do is find one that does have the active forms, folinic or 5-methyl tetrahydrofolate, methyl B12. Those are superior. You may not find a supplement that has absolutely all of these, and it will not be one pill. It will be 4 to 6, depending on the supplement and whether it's capsules or tablets. So preconception, prenatal, and postnatal. You want a prenatal, multiple vitamin mineral. You want folinic or 5-methyl tetrahydrofolate. And you want probiotics, 10 to 50 billion. Omega-3, a total of 1,000 to 3,000 milligrams or more. DHA, at least 500. EPA, at least 500. If you're eating fish, that might be enough. If you're not eating fish, you would want more. Vitamin D3 total, 1,000 to 4,000 or more, 6,000 if breastfeeding. The basis is the test. It should be tested before you become pregnant. It should be tested during pregnancy because it is too important. We do not accept low normal. Anywhere from 30, well, below 30 is severely deficient. From 30 to 40, there's deficiency. You want to be optimum. You want an optimum income, you want optimum health, you have optimum nutrient intake. And what else can be taken? Magnesium, 400 to 800 milligrams in divided doses. The B vitamins that are listed there. The biotin, extra zinc is needed. Vitamin E is mixed tocopherols. Vitamin C. Now, herbs and pregnancy. I listed some of the avoids. There's much more information out there, but these are the ones to avoid. Aloe, arnica, camphor, cascara, cohosh, comfrey, donquai, feverfew, ginseng, kava, licorice, pau d'arco, pennyroyal, red clover, rosemary, senna, turmeric, and yohimbe. The safe ones are ginger. It's good for anti-nausea. Dandelion, anti-nausea. Oat and oat straws, calming. Peppermint leaf, anti-nausea. Red raspberry leaf, uterine support. Slippery elm is anti-nausea. It's good for the gut health. For lactation, we use fenugreek and we use fennel seed, and they help milk production. Now, some prenatal, perinatal, postnatal issues. Edema and toxemia, make sure protein, water, and salt are included. Magnesium, B6, and vitamin D. Pregnancy nausea, acupuncture. There's nothing better for pregnancy nausea. Works for chemo nausea too, as acupuncture with someone who knows, has the skill for that. Ginger, peppermint leaf, magnesium, B6, amino acid supplements, protein frequently. Indigestion, we can use probiotics and biotin. And again, peppermint, slippery elm, soup and purees and small meals help you digest, and acupuncture. Delivery, 1 week before, you stop your omega-3, your vitamin E, and your magnesium. This is important. Omega-3 and vitamin E reduce clotting, and you want to make sure you do clot. So that will be told to you by your doctor. But magnesium relaxes muscles, and we don't need relaxed muscles in labor. Continue and increase vitamin C, B-complex, zinc, and calcium. And within 1 week, return to your prenatal supplements and add some fenugreek for nursing. Infant bilirubinemia, vitamin E, 50 IUs for 1 day can reverse it. Magnesium sulfate is the anticonvulsant of choice for treating eclampsia. It is more effective than diazepam, phenytoin, or what they call the lytic cocktail. Now, breastfeeding benefits. It releases oxytocin, which promotes nurturing, reduces stress, improves uterine health, and it protects against breast cancer, ovarian cancer, weight gain, diabetes. In the infant, it provides beneficial flora, antibodies, omega-3 fatty acids, oral motor development, and it does protect against SIDS, digestive problems, infections, and malocclusion even, because the act of nursing, the child thrusts the jaw and pumps at the breast. And that doesn't occur with most of the nipples that are available for bottles. Infections and allergies, malocclusion, I mentioned, tongue thrusting, and obesity. And we know that milk-based formulas tend to promote overweight. And that goes into adulthood. Postpartum depression. It affects 1 out of 7 postpartum women. Signs: depression for more than 3 weeks postpartum, a loss of pleasure, joy, self-confidence, difficulty sleeping at night, daytime lethargy, just not caring, appetite loss and or craving for sweets, anxiety or chronic worry, prevention and treatment strategies, glycemic control, and excellent hydration. We'll go into that in the diet area. Frequent meal snacks, and always with protein. Have protein every time you eat. Have it first. It stabilizes blood sugar. Excellent sleep. Take breaks from the baby. Get help from others. Exercise. A higher nutrient intakes of omega-3, magnesium, B vitamins, D, and E. And I want to re-emphasize the safety of supplements. Again, Why they have such low toxicity is when you're deficient, the body puts out signals to absorb more and to the kidneys to hold on to more. As your levels improve and function improves, the body absorbs less and retains less. It's called homeostasis. It is very hard to achieve toxicity with supplements, and drugs are not regulated by the body in a homeostatic mechanism. Now, cholesterol, very important in fertility and pregnancy. It's produced by the liver, and it makes reproductive hormones and vitamin D, brain and nerve development and structure, serotonin metabolism, and antioxidant functions. Cholesterol should increase in pregnancy and breastfeeding. It's critical to pregnancy. 200 to 325 milligrams per DL in second and third trimesters. That's the blood level. And if a doctor tells you that you're putting your child at risk for heart disease because your cholesterol is going up, that's incorrect. It has to go up because the baby needs it. And it's the old wives' recommendation, old wives' tale, is eat eggs. And I couldn't agree more. Eat eggs, especially hard-boiled, poached, or soft-boiled. If triglycerides and LDL are elevated, it's not a fat problem. It's a sugar problem. Excess glucose converts to triglycerides and increases LDLs. Statins should not be used if improving fertility and attempting to become pregnant. They reduce the production of cholesterol, which is necessary in fetal development. Statins cause birth defects. Importance of salt in pregnancy. Blood volume expands about 40% as the pregnancy progresses. Salt and protein maintain what's called osmolality of this volume. Pregnancy salt restriction results in reduced blood flow to the kidneys and placenta, high blood pressure and tissue edema, and as blood volume increases and salt intake decreases, blood osmolality becomes too dilute because of insufficient concentration of particles in the fluid. So what happens? The fluid moves to the tissue to keep the osmolality in a homeostatic range inside the vessels. And this causes tissue edema and reduced blood volume ultimately. The vessels constrict to compensate for low blood volume, and the constriction causes high blood pressure. And this salt restriction leads to preeclampsia, high blood pressure, weight gain, anemia, proteinuria. And it used to be that women were told to restrict salt in pregnancy. There may be a few unique individuals that need to do that, but by and large that is no longer recommended. That's been true for about 40 years. Animal studies show that perinatal salt restriction leads to insulin resistance and obesity in offspring. That was new information. Alcohol, drugs, and tobacco, gone. Pregnancy diet avoids, absolutely no. Artificial sweeteners and additives, high fructose corn syrup, sodas, diet and regular, hydrogenated oils and trans fats, raw meat, seafood, and eggs. This is in pregnancy, soft tissue, soft cheeses, quinine, sugar and caffeine, refined grains and processed foods, deep fried foods, and any food that you have a reaction to. The basics: organic, eco-friendly, whole foods, nutrient-dense, beneficial fats, beans, nuts, and seeds, seafood, meat, and eggs, homemade broths, vegetables and fruits, fermented foods, and as I said, whole grains. Healthy eating. Avoid foods that cause reactions. The first food or drink of the day sets the glucose standard for the day. Have protein first. Fish, poultry, meat, eggs, beans, nuts, seeds, and milk products if tolerated, especially high-quality protein milk products such as Greek yogurt, cottage cheese, and cheeses, not soft cheeses. Protein and fiber, very important. They benefit glucose control, mood, attention, and endurance. And by establishing glucose control, you feel better in your pregnancy, absolutely feel better. You have more energy, but the infant isn't being pushed toward diabetes and hypoglycemia problems. Increase fiber through vegetables, fruits, nuts and seeds, whole grains, real oatmeal, brown rice, tabbouleh, the cooked cereal type whole grains. You can add guar gum. Organic is more nutritious and reduces the load of harmful additives, pesticides, and chemicals. So low-fat and light foods are usually glycemic and can increase hunger, triglycerides, and weight. Now, here is a good paradigm. I do not use the pyramids. I have never used the pyramids. They're inaccurate. Protein, fat, and carbohydrate. Under protein, we have animal source choices and plant source choices. Seafood, meats, poultry, eggs, milk products, and then beans, nuts, and seeds. Now, several comments here. Milk products are not necessarily a necessary food group. They've only been part of the human diet for 0.0005% of human history. They're new in the human diet. They're about 5,000 to 10,000 years. It is incorrect to mandate that milk products are essential. They're a protein choice. For some people, not a good choice. If people have to be casein or milk-free, there are plenty other options. If people are soy-free, they would eat other beans, but not soy. Now, fat, saturates we make, but we can also eat them. Not all saturates are bad. Unsaturated fatty acids, the omega-9s that we call the Mediterranean oils, olive oil, avocado, and almond oil, very healthy. And then the polyunsaturated omega-3 and omega-6 are essential. Omega-3 we've talked about. The most direct forms come from fish, but the indirect forms can come from beans, nuts, and seeds. The conversion to the active forms is inefficient. And omega-6 is usually too abundant in vegetables and their oils. Now, carbohydrates are high in fiber. Vegetables, fruits, grains, beans, nuts, and seeds. And if you're gluten-free, then you would not be consuming gluten. So if tolerated, I have these little stars, if tolerated, you can take these foods, but avoid if gluten-free, casein-free, soy-free. And this is the paradigm I use. It's a square meal, square plate, and protein at every meal and snack. More vegetables, raw, cooked, steamed, in soups, in stews, in spaghetti sauce, in smoothies, any way you can get them in. And then optional, you don't have to have it at every meal, fruit, starch, and grain. I would rather people eat a whole fruit than any kind of a bread. Even a whole grain that's high fiber may be too glycemic for some individuals. And summary of goals, 3 to 6 months before and through nursing, optimum nutritional supplements for age and stage, healthy weight and body fat percent, nutritious organic diet that is glycemically stable, optimum water and salt intake, regular exercise and reduced stress, medical and nutritional evaluation, avoidance of toxins, drugs, alcohol, and pollutants, optimum restful sleep, acupuncture to improve fertility, energy, and outcome, and excellent preconception, prenatal, and postnatal care. And this is about Autism 360. You will have this in your handout. Very important for those who have children on the spectrum or the symptoms on the spectrum. And these are our two books. Dr. Compart and I, Dr. Compart, Pamela Compart, is my co-author. So we've talked about it. Now let's go to questions.
Okay, great. Thanks, Dana. That was an excellent presentation. So for people who are on the line, I want to let everyone know the handout, we do have the link in the chat right now, so I know people were asking about it. You can get the link there. We also had it in, we'll have it in the email that you receive later today after the webinar concludes. And once we post the webinar on our website, that link will be with the webinar video as well. So you'll have lots of chances to download it if you're looking for it. We do have a few questions here. We have time for several, so I'll start reading them off. The first one, Dana, is you mentioned that infections can be a risk factor for ASD. Do you mean IgM or even IgG? If even IgG, what can be done if you're the carrier of herpes or other infections?
Well, the infections, the IgE and IgG are allergy reactions. And IgE is a histamine type of reaction to a food or a substance or inhalant, grass, trees, pollens, molds. IgG is a memory antibody that once exposed to something and you have a reaction, a histamine releasing reaction, then you make a memory IgG. And that memory IgG is prepared should that allergen present itself again. So those aren't markers for immunity. There are hundreds and hundreds of markers for immunity that can indicate increased inflammation. And this is sophisticated testing. Now, I've put all of this information on the slides, so it's in the handout, and you can certainly go further. We covered what could be a 2-day course in an overview. But if somebody has autoimmunity in the family, you might want to get tested, an autoimmune immune profile. That's a very sophisticated profile. And you can talk to your primary care, to your OBGYN. You may want to see an immunologist if this is significant in your family. I hope that answered it well.
Yes, that was great. The next question is it known if mothers with mitochondrial dysfunction are at all prone to lower milk supply? At least on the surface, it would seem that milk production is an energy-sensitive process. If so, what might be the best bets for improving the situation?
Well, that's interesting, and I have seen that. I can't say that it's an overwhelming finding, but yes, the body needs ATP. All cells have mitochondria except red blood cells. So every cell except red blood cells makes their own energy, ATP. And if that production by the furnace in the cell, coenzyme Q10, manufactures body energy, ATP, if that's inefficient, there are going to be problems in fertility, in pregnancy. It really depends on the level of inefficiencies. We're talking about inefficiencies, dysfunctions, not major disease, not major mitochondrial disorders. And it's important to note that difference. And I think it's the autism community where we've discovered that this is a concern, that the mitochondrial function is not optimum. And that leads to a lot of problems. My analogy is if you've got a bunch of appliances and lamps blowing fuses and not being able to dry your hair and also run the oven or the washing machine or dryer, then you bring more electricity into the house. You don't hire 30 appliance repair people to work on the appliances. It's the lack of core energy coming into the house, and that's what happens in the body. And the blowing of fuses and the problems that occur in the body are a whole host of problems, from mental to physical to energy to all of our functions. That's why every cell makes its own ATP. It's really neat the way the body is designed and works.
Okay, this mother is asking, under womb environment risk factors, you mentioned alcohol. How early in a pregnancy can a fetus be at risk from alcohol consumption? Is it at pregnancy, at 4 weeks, later, earlier?
It's immediate. It's from conception on. And that's why we say, and I actually should have put that on the slides, if you're thinking about getting pregnant and you're being exposed to getting pregnant, that's the actual medical term, then you should pretend you're pregnant. and you should eat like you're pregnant and avoid alcohol like you're pregnant. Now, is a sip of alcohol going to undo somebody? Well, probably not, but you may not know how your body, especially in pregnancy, is detoxifying that alcohol. The baby's liver doesn't clear it. It goes to the baby's brain, and it actually causes death of brain cells. And now, there are people that drink heavily through pregnancy. We know that that certainly causes fetal alcohol syndrome. But I have really spent a lot of time on this subject because I didn't believe it when I first saw that it is the most major teratogen, because some of the other teratogens that are well known only affect development in a narrow range. Alcohol is detrimental from the beginning of pregnancy till before birth. And so the answer is the ideal level is none, but there's a big difference between somebody drinking a six-pack a day and somebody who had a sip of alcohol. It's just not a smart choice. And I don't think I finished the answer. I realize for the question before on what to do about mitochondrial health. What we do is we use CoQ10, carnitine, B vitamins, magnesium, biotin, zinc. These are things that support healthy mitochondrial function. And somebody who is skilled in nutritional biomedical interventions and nutritional chemistry and biochemistry can be very helpful.
Okay, the next one. This person is asking, what testing might be done to the mother and father regarding MTHFR or other genetic mutations before conception?
Well, you can have gene SNP testing, and there are a number of labs that do that. You can talk to your doctor about it, but I suggest you go online and look up testing for gene SNPs and inform yourself about what panels are usually used. Now, you really can't feasibly do every test. Some of the companies offer tests specific, say, to predispositions, gene variants, to identify gene variants that might predispose you to cancer, diabetes, cardiovascular disease, inflammation. The MTHFR variants are many. There's 40 to 50 of them. Some of them are not bad. Some of them are variants that occurred in our human progression over time that are beneficial. But many of them are problematic, and there's 2 or 3 that are more problematic than others. And when you go in the literature on the MTHFR, they will delineate which ones are the more important ones to test for. But it would just be unreasonable financially to afford to test for every possible gene variant there is. And that's why when you work with someone who understands this testing, health history is a critical piece of information because it guides. I've recommended to adults and children that they have the MTHFR tested as I'm taking a family history, and especially in a child, hearing the mother's history, the mother's family, the father's history, father's family, and it becomes clear that likely MTHFR defects that are significant are going to be found. And so far, I've been right on the case. I've been right on about it. But I'd rather err and do the tests than not do the tests.
And speaking of tests, this next question, they're asking about a test for maternal fetal antibodies that attack the brain.
No, I do not think they do. I think that's a blood test.
Is it a test that they can access?
It's not one that's easily done, but yes, it is accessible.
Okay. All right, so the next one is, they're asking, is flaxseed oil a safe omega to take during pre-pregnancy?
It's certainly safe. And flax seeds ground are also very good because you get the fiber. In the oil, you don't get the fiber. It has ALA that converts to EPA and DHA, and that conversion in the healthiest person is very inefficient. You have to take 5 times as much oil, maybe even higher, to equal what you get in fish oil, or the neuromins, which is a concentration of the algae that the fish consume that gives them the DHA. So for people who want to be totally vegan, what we do is recommend that they take the neuromins. It gets to be pretty expensive because that concentrate is just less available, harder to come by as far as being financially feasible to take enough. So it doesn't hurt to take the flaxseed oil, but relying on it might not work for the individual.
Okay, we've got time for just a couple more. This is an interesting one. This person's asking, they're saying that their rubella IgG is very high. So this is the mother. And they're wondering if there's anything that any research they should do before pregnancy about that.
It depends on the number, and there is some evidence that very high IgGs for rubella can be problematic. It's hard to isolate just that test and make a determination. Go into the literature and look at it, and then talk to your doctor about it, and perhaps even an expert who can give you more advice on that. There have been some connections in the past. I haven't noted that recently there's a lot of emphasis that those high levels are a risk factor, but certainly I have seen that in the literature. I just don't think it's prevalent at this point.
Okay, this next one is from a nutritionist who lives in Venezuela. She's been working with autism, food intolerance for more than 8 years. And she didn't realize, she's saying here, that taking folic acid was problematic. So I think she's looking for resources and research about that. Do you have anywhere we could point her? She wants to know more about how to...
Yes, if she goes in the literature and just looks up the difference between folic acid, folinic, and 5-methyltetrahydrofolate, there's a lot out there. I have a nice handout on it, and I can be reached through my name, which is Dana Lake, L-A-A-K-E, 2 A's, at AOL.com, and I can send the information. What it is, it's well understood that the methyltetrahydrofolate defects, the methylation defects, don't permit folic acid to convert well to the active forms. The methylfolates, folinic is another one, but methylfolates are more direct. And in severe cases, maybe almost no folic acid converts. It builds up when you take high doses of it and blocks the receptors for the active forms, rendering the individual more problematic. And this is actually was discovered in cancer research in the mid-90s and part of some of the epigenetic findings. So you will see that folic acid can increase certain cancers, but it's important to take a look at the literature on MTHFR defects in order to understand the biochemistry that's involved. And you can see the reason why I say I want my patients on multiples that have the active forms. A lot of people aren't tested. They're not going to get tested, and it does no harm to provide the active form. Whereas if you're providing additional B vitamins to somebody and they actually have the problem, they're in trouble. Or they could be in trouble. It's not a guarantee.
Okay, great. Here's one final question. So this person is asking, it's a two-part question. The first question is, do you have any great books or suggestions for vegan parents who are becoming pregnant. So maybe they're looking just for resources again. And then the other question is, along with that, do you have a prenatal that encompasses all the needs for a parent trying for a second child after a assisted child?
Am I permitted to mention names of companies?
Yes, if you've got a multivitamin that you recommend, I think that's
yeah, Thorne and Pure Encapsulations put out pretty sophisticated prenatals that they use the active forms of the B vitamins. So I think that's a good one. As far as vegan, according to nutritional anthropologists, there are no long-term pure vegan societies that we can study. In other words, it is more prevalent now, and I work with, if people want to be pure vegans, we use amino acids supplements to help out. I worked with a doctor who dealt with people who were vegetarian and vegan, and when she started doing the amino acid tests, the B vitamin tests, she says they're showing up with a lot of problems. And this occurred more readily from people coming from other cultures. And what was discovered was that in those cultures, there's a lot of contamination, bug contamination of the grains. And that's where they were getting their B12. And when they came to this culture and we don't have as much, and I actually saw, we looked in the microscope, it was a very interesting course. So we can supplement, and anybody who's vegan and wants to get pregnant needs to go through very sophisticated nutrition testing. It's not going to show up on a CBC and chem screen. If it shows up there, your deficiencies are very severe, because those numbers will not show up deficiencies in calcium, magnesium, potassium, and the B vitamins. They will not show up until extreme late stages of deficiency because of the homeostasis that I described during the slide presentation.
Okay, great. Well, Dana, thank you so much. This was a really helpful presentation today. For people who are still with us, we are going to be meeting again next week. We've got a talk coming up on environmental toxins and autism. It should be really interesting. So if you haven't registered yet, you can sign up at ariconference.com. And this particular presentation, the one we listened to today, will be online probably by later today at ariconference.com. So thanks again, and thank you again, Dana. It was a pleasure.
Thank you.